A pill to treat COVID-19 is showing promise. Researchers at Georgia State University and Emory University developed the medicine. Natisha Lance spoke with them about how this drug could be a game changer in the fight against COVID.
A little red pill, now a potential part of the defense arsenal against COVID-19. 5 years ago, researchers at Georgia State University developed the chemical compound now called molnupiravir while testing against influenza. When the pandemic hit last year, the scope of the research changed.
And we quickly redirected because we knew this drug has actually broad spectrum antiviral activity, so it was very potent against influenza virus. It also had activity against several other viruses.
They tested the drug on ferrets infected with COVID-19. Results showed the drug prevented the infected, treated animals from spreading the virus to untreated ones.
Such a drug can greatly contribute to silence the pandemic.
Now the drug, owned by drug maker Merck, has shown to be effective in humans during phase 3 of its clinical trial. The drug maker says it reduced hospitalizations and death rates among infected patients by half. Results so encouraging, it stopped its trial early to seek emergency FDA approval of the drug.
The importance and the potential impact that such a drug could have, not only in the United States, but also in low and middle income countries for an effective and cost-effective oral therapeutic. I think all of this weighs in heavily that the drug will be approved.
That pill is promising news as Georgia is inching closer to reaching half of eligible people fully vaccinated against COVID-19. But we are still well below the national average. Right now, at least 48% of people in Georgia who are 12 years old and older are fully vaccinated. Health experts say that makes them less likely to wind up in the hospital or to potentially die from COVID-19. But the national average vaccination rate, that is much higher. About 75% of Americans in that same age range have had a first dose, and 65% are fully vaccinated. Now, where we are making progress is a drop in COVID patients in the hospital. As of Friday, we have over 3,100 people seeking care. That's about 19% of all patients statewide, just below the CDC's threshold to ease the strain on our medical resources. Now, sadly, COVID-related deaths still remain high in our state. On Friday, at least 143 more Georgians lost their lives to the virus since the day before. Here in Metro Atlanta, one company doubled its employee vaccination rate in just a matter of weeks. Joe Ripley tells us more about Tyson Foods' efforts and the impact on community COVID spread.
As of the end of September, 91% of employees at Tyson Foods Incorporated have gotten at least one dose of the COVID-19 vaccine. That amounts to more than 100,000 people. A company spokesperson said that number doubled after Tyson announced a vaccination requirement for employees back in August. Tyson has 6,000 employees at plants across Forsyth, Lumpkin, and Dooley counties of Georgia. Nearby Hall County also has a strong chicken plant and agriculture workforce. COVID cases and positivity rates in all of those counties are above the statewide average, meaning the virus is more prevalent in these communities. But data from the Georgia Department of Public Health shows Forsyth County's positivity rate dropped 25% over the last month. Compare Tyson's 91% vaccination rate to that of the above counties. And while the data doesn't definitively say employer vaccination mandates resulted in lower COVID cases overall, data does show the higher the vaccination rate in a community, the lower its positivity rate. Tyson offers free COVID-19 vaccines on site, and vaccinated employees are eligible for a $200 bonus as well as potential additional prizes.
Tyson says it will continue to educate employees about COVID-19 vaccinations. It says it is considering the request of some employees, not a specific number given, of those requesting medical or religious exemptions from taking the COVID-19 vaccine. But ultimately, the company says vaccination is a condition of employment.